Hi, I'm Santa Clara County Supervisor Dave Cortese, and welcome to our regular Saturday Town Hall discussion and COVID update. We have been doing this for several weeks now. We took a little break on the Independence Day weekend for obvious reasons, and I imagine some of you who have been following these town halls every Saturday were happy to have a break. But there's a lot to talk about this week. I'm going to sort of give you a brief recap on the indicators I always touch on, which are kind of unique to what I watch. And I want to introduce our special guest. But before I introduce him, let me just say that there were 5,863 confirmed cases of COVID-19 in the county and 166 deaths as of Friday. And as you know, I always mention the deaths. You know that if you watch this from time to time, not because of any focus I have on mortality or death per se, but it's always occurred to me since the pandemic started that as long as we're tracking the mortality rate, it is one of those indicators that just simply doesn't lie. We have to watch everything else, hospitalizations, we'll talk about that today. We have to look at testing results and percentages and a lot of other things and what's happening worldwide, nationwide. But you know, it seems as a public servant, one of the most fundamental things we can do is just look at how many people are surviving in our own county, who isn't, and try to focus on that and make sure that we're obviously mitigating that as much as possible. Our hearts go out to all the families who have suffered a tragedy within their family. I know it's certainly struck families among my friends and extended family, and the disease itself spares no one. Anyone can be a victim of it. So we're going to talk about all of that a little bit more today with our special guest today. He is Deputy County Executive David Campos. He doesn't need this extra introduction I'm going to give him, but just in case some of you pay a lot of attention to Bay Area politics and what's happening in the region, he was once a San Francisco County Supervisor not so long ago. We actually served together in a regional capacity in places like the Metropolitan Transportation Commission and in other regional government functions. He's been a tremendous leader, and we were very fortunate to have him join the County of Santa Clara some time ago as a Deputy County Executive, meaning he reports directly to Dr. Jeff Smith, our County Executive. And part of the reason that's important is because we have somebody on the executive team here today to help answer your questions at a time when things have been changing quite a bit, not just numbers and percentages, but the rules have been changing by design. Dr. Sarah Cody is in steady contact with Mr. Campos. He is part of the Emergency Operations Center where decisions are made. He is functioning as a public information officer for the Emergency Operations Center, so he's part of his job, part of his vocation right at this moment is to save lives by getting information out there to help protect people and to help explain the rules to some degree. So we may not have all the answers today, and I certainly don't want to put any pressure on our special guest, but we do know that you'll call in with questions, you'll text in with questions. The way to do that is listed right on the screen. And we're happy to take our best stab at giving you answers. And if we can't answer, we'll tell you how to get the answer by Monday, because there's certainly an answer to every question that can be posed, I think, on this topic. So, except how to stop the virus completely. That's the one answer we haven't come up with. So with that, let me introduce Deputy County Executive David Campos and have him do a little bit more of a self-introduction, maybe just a few words from you about what it's like to be in the EOC.
Sure.
That wasn't something
right
that you planned on as far as your resume, but it's been all hands on deck for a while now. And,
sure. Well, thank you very much, Supervisor Cortese. And as you noted, I've had the pleasure of serving with you on regional government, the Metropolitan Transportation Commission. And, it's really one of the reasons that I was really excited to come to Santa Clara, having seen through that work, watching Supervisor Chavez, and all that Santa Clara has done to really be leading on so many different fronts. So that's been exciting and proven to be true. And in many respects, the way that Santa Clara County has approached the response to the pandemic, the coronavirus pandemic, illustrates how this county has really become a leader in the state, in the region, in the country. So I was asked to come to the Emergency Operations Center, really for the purpose of helping disseminate public information. And I think that having been a supervisor and being an elected, I think that gives you a perspective in terms of the importance of public information, how to interact with the media, but also the different ways in which information needs to be disseminated. And when I came over to the Emergency Operations Center, my goal was to really develop the information dissemination piece into a model for the region, the state, and the country. And I think in many respects we have achieved that, because what we have tried to do is to make sure that we provide as much information as possible, that we are as transparent as we can be. So one of the first things we did is we started doing more media. We developed a Facebook Live, and now the county is essentially running 5 different websites in 5 different languages. We have Facebook pages in different languages. We create information in different languages, not just translate what we provide in English, but actually create information with monolingual speakers in those languages, to the point that some of our pieces of information, some of our public service announcements have reached a viral status, going viral in other parts of the world. Vietnamese being a good example. Some of our Vietnamese PSAs have had millions of hits because people in Vietnam are watching them.
Makes sense.
Very proud of that. And of course, that's also a reflection of the work of the board, right? Because the board has really prioritized that and made it clear to the administration. So in that sense, we are really, an extension of what the board wants to see an EOC that's connected to community.
Well, if it's going right, we take credit for it. And if it goes wrong, we tell everyone to call the Emergency Operations Center. So I'll introduce the rest of the team here in a moment, but why don't we take a question or two? Tara?
Yeah, so the first question texted in is, will we be able to maintain the reopening schedule given the current surge in cases?
Yeah, it's a great question, and I want David Campos to really take a crack at this one, because he's even closer than I am, obviously, to the EOC. But of course, we're all watching the rapid increase in hospitalizations more than anything. Sure. David, can you speak to that?
Sure.
What's that look like from inside the EOC to watch those numbers go up and to be concerned about opening?
Well, we watch numbers on a regular basis. We actually, look at the numbers not just at a daily basis, but actually throughout the day. We're analyzing them. And, we have been fortunate in Santa Clara that up to now we have had the lowest per capita number of cases in the state. We've been sort of like fighting, with San Francisco in terms of who has that spot. But in terms of large counties, we've had that. We have seen an increase, nevertheless, and in many respects, the increase is something that is a natural result of what has happened, because we have seen more openings in different parts of the economy. We've had most of our businesses, small, large, open in Santa Clara County. We also know that there are a couple of things that happen, especially around Memorial Day, perhaps around 4th of July, where there have been more gatherings with people are not necessarily taking the precautions. So we are watching this carefully, and it's not something that's specific to the county of Santa Clara. It's something that is happening throughout the region and throughout the state. That said, we believe that we can move forward with the proposal that we have laid out. And the idea behind this is that shelter in place has a very important role, right? Mm-hmm. And shelter in place was a very useful tool, an effective tool to contain the spread of the virus. But you do reach a point after which shelter in place no longer on its own becomes the right strategy. And so the next phase is to go into a phase of risk reduction that recognizes that for us to have a long-term strategy with the virus, that it's not sustainable to have people shelter in place, indefinitely. And so the right approach, if you have contained the virus to the point that you have enough of an infrastructure, contact tracing, testing to deal with the cases you have, that you move into risk reduction. And that actually becomes a very important tool, because it really is the only thing that we have short of a vaccine or a cure to deal with a virus that's going to be around, right? It's how we as individuals and how we as businesses, how we behave, how we act with one another, relative to one another. And so that's why under this phase we are able and confident that if people follow the rules that we have laid out, a lot of things can resume, provided that those guidelines are actually followed.
Yeah, and I know we have another question, but something I want to come back to after the next question, if we have time, is these new rules. What people are calling an opening, an expanded opening on the 13th of July. I mean, that's tomorrow. Basically, all the protocols have to be in the next 24 hours or 48 hours, as I understand it. But they're not easier rules. At some point, I want you to talk about the fact that the new rules for reopening are actually very, very restrictive, and people are unfortunately, in a sense, going to find that out when they go back to their barber or their hair salon or their nail salon, because it's not going to be like it used to be.
You're letting a lot of things resume, but in a very different way. It is really the new normal is not what it used to be, right? And so that means, by the way, that businesses that are resuming operations for the first time have to file these new plans. Also, the businesses that are actually already open under the existing order have to file these new plans, and they have to do so under penalty of perjury. And the reason we did that is because we want people to understand the importance of being truthful. So there are specific guidelines, including restrictions on the number of people you can have inside. There is a 250 square rule per person in terms of employees, 150 per customer. So very strict guidelines that are trying to keep people safe if they follow them.
Yeah, I used to go to a barber that everyone used to sit around in close quarters. It looked like something like a throwback. And there was usually sports on the TV, and there were little kids running around, and they'd jump in your lap, and
Right.
everyone would be talking, and you'd get most of the local news just by sitting in the shop. Those days are over for now, right? And that's not going to happen.
Absolutely.
Tara?
So we've had a lot of questions come in, and one is from Chuck Stevens from IATSC Local 134, their Theatrical Stage Employees Union. And Chuck says, "Thank you both for keeping us up to date, and thanks for your service. My question is in regards to the entertainment industry. Our industry has gone with everyone local out of work. What will gatherings in the entertainment industry look like? For instance, the San Jose Convention Center."
Yeah, well, this is where the new rules change things, because as I understand it, David, please explain this as best you can. It's not so much what industry it is, with a few exceptions, but it's about the density of the amount of people that you put in. So I'm thinking the answer here is, look, if you can figure out a way to do entertainment and still keep the 150-foot distance requirements, then it works. Is that a short answer?
Well, I think it's a two-part answer. In many respects, you're right. We're not focusing on the type of business or the type of activity, but there are some things that by their nature are not allowed, and so there are things where, for instance, you have large gatherings where even though you might be able in some respects to keep the desired distance, the health officer doesn't believe that a large gathering makes sense.
Especially indoors.
Especially indoors. And there are certain principles, by the way, like indoors is safer than outdoors. So movie theaters, the types of large gatherings in the convention center that perhaps the gentleman is talking about, those would not be allowed. Even something like indoor dining is not going to be allowed because there are certain principles that need to be followed. One, indoors is safer than outdoors. You have to wear your mask.
Outdoors is safer than.
I'm sorry, outdoors is safer than indoors. And even when you're indoors, you have to wear your mask. And so if you're indoors and you're dining, you're not really able to do that. So there are certain things that by their nature are not allowed. Everything else that it doesn't fall within that, it's about how you do it. And in a way, it's sort of what happens with sex education. It's like abstinence only takes you so far. This is about safe sex, and in many respects, this is about the safe interaction of most activities except for those that are inherently dangerous.
Well, if we get any sex education questions, you're handling them. I'm having a hard time with COVID as it is. Let me just say, for those that are wondering, we do come in and out of this little studio with masks. It's very limited here, and we're 6 feet apart. In case you're wondering, it probably could tell by the screen. And we have a very limited production crew here of a couple people. Tara, Janice, Min is running everything, and Tevu and Nguyen is outside, not even in the same room. Two of them are. So we're following the rules ourselves, but I appreciate that response. Tara, what else do we have?
Yeah, so we have a specific question about the Food Facilities Directive from a small restaurant owner. And they ask, we're a shop that's 95% kitchen with no dining area in the county's square footage protocol. How can the county those that don't have dining areas? And his larger question is, why does the order have the one-size-fit-all approach?
Well, I think that we don't necessarily, have a one-size-fits-all in the sense that what we would ask is if there are specific questions that people have that are specific to their, business. And as lawyers, we know that the devil's in the detail. I would ask that they contact us. We're happy to look at the specific situation. I know that we can take the information from the supervisor and have someone follow up. But again, the reason why indoor dining is specifically prohibited is because we don't believe that we can allow that and still keep people safe. To really be safe indoors, you really have to wear masks, and that's not really possible.
Yeah, and one of the things I've raised as a county supervisor when we've had public hearings is, the fairness issue. For example, we have, life, they say life isn't fair, but we'll have one restaurant that happens to have patio space, and so they're open right now. And then right across the street, there's an equally good restaurant with hardworking people, but they did not have any patio space because of the design of their building. And so, how do you reconcile that? Neither, the one across the street doesn't do anything wrong. They just don't, you just have to have some outdoor space to operate under the rules. And these are state rules right now as well. They're not just county rules. So as we found out about a week ago, there's some of these rules the county and the county restaurants have to abide by, otherwise the state will come swooping in and take matters in their own hands.
Absolutely. That's correct, Supervisor.
Yeah, so one of the things I will say for those who want answers to specific questions is feel free to call the numbers on the screen or write through those websites. And you can even reach Mr. Campos indirectly, of course, through the website that's up there. You can reach either of us that way. But we're happy to route the question around and get answers for you on Monday. And some of the issues about outdoor dining will be in the hands of cities, which are now going through the process of trying to create outdoor space for some of the restaurants that didn't have that in the first place, sidewalk space or even street space. So we're happy to try to get you that information as it's available.
So we had several questions about school reopening. So one from Derek is, some school districts will have a blended opening model of distance learning and in-person schooling. Will the county provide additional guidance?
Maybe you could talk about the County Office of Education's guidance and the fact that we have 28 school districts that are involved in this decision.
Sure. So let's just say that from the very beginning of the pandemic, Dr. Cody has made it clear to us that opening schools in a safe way is a priority for her, because she understands the hardship for parents, for families, and for kids, for young people, when schools are not open. And so from the beginning, there was actually a working group that was created that included officials from the Public Health Department and the County Office of Ed. And they have been working together to develop these guidelines. And so we actually put them out a few days ago. And what those guidelines provide is a threshold of what we, from a public health perspective, believe is needed, and general sort of basic principles that the school districts need to follow, with the understanding that with the 28 plus school districts we have, that ultimately it will be up to each school district to decide for itself, based on the threshold requirements that we have, what makes sense. And there are two things that have to happen. One, there has to be compliance with the guidelines, and again, each district may decide to do it in a different way, including blending, telelearning with in-classroom learning, perhaps not allowing in-classroom learning. It depends on what the district decides. That has to happen, compliance with the rules. But the second thing, and this is really important, this is where all of us have a role to play, there has to be across the county enough containment of the virus. If we have the number of cases is so large, is so huge, that we're not in a position where we feel that we're in control, we don't believe that we can safely allow the opening of schools. So those two things need to go hand in hand, and in that sense, all of us have a role to play in making sure that we contain the cases, which is why, following this new normal of wearing a mask whenever, or a face covering whenever you're outside, understanding that that you're safer outside than inside. So if you're going to meet with people, that it's better to do it outdoors if you can. Maintaining social distancing, all of those things are important. And then of course, the other thing that the county has done, because we couldn't do this without this, is that we have developed over the last few weeks a very robust infrastructure that ensures that we have enough testing going on, and that once people are tested, if they're found to be positive, that we can trace their contacts, isolate them, and the people that are testing positive, that they have the resources needed, to get well and to not infect others.
Yeah, well, that's great. I know it's challenging for people for all the reasons you indicated. And then, you worked in the school district business in the legal side of it, and I was a school board member, and you're supposed to have everything in order right now for opening schools. Basically the day that school ends in the summer, the principals and the teachers are already setting up shop for the fall, and this uncertainty is just really hard for people, and it's it's really difficult for education in general. But it's the nature of this virus that it keeps bouncing up and down, and it keeps changing every week, and makes things extra difficult.
The one thing that I would say about schools, because I have sisters who have kids, and they ask me all the time, the one thing that has been comforting for us is that in looking at the research, that the experts who first thought maybe COVID-19 is like the influenza virus, right? That kids can spread it really easily, and so that's might make schools more dangerous. The research, the studies that have been done don't show that. They don't show that. In fact, they don't show that kids will be at least have transmitted it in the same way that it happens with the flu. That in fact, they believe that the transmission is more likely to occur from adult to a child than a child to an adult, or a child to a child. So that has given us more comfort in terms of moving forward with this prospect of opening schools, again, provided that these other things happen.
Yeah, and then you have, like in a high school district, maybe 1,200 teachers who are adults, who are coming in and out and moving around, and are used to going in and out of the faculty room and the library and everything else. So how do you, it's always a little more complicated than it seems, right?
Right, and that's why the rules for elementary school are different than they are for middle school or high school, because middle school and high schoolers are more like adults in terms of how they react to the virus.
Right.
So, one question on Facebook. The County Public Transit Directive says that transit agencies need to provide hand sanitizers on buses and trains. How will the county enforce this for VTA, BART, etc.?
Yeah, well, Nuria Fernandez, the general manager of the VTA, has briefed me personally and directly, as well as the VTA board recently, and they're taking all the county and the state requirements very seriously. But they have that plan to make sure that everybody is 6 feet apart, that sanitary conditions prevail, that there's sanitizer available. And now it's just got to be implemented. And enforcement and implementation has been the most challenging thing about all of these rules at some point. I know just this morning somebody wrote me an email and said people weren't wearing masks I can't remember if it was on transit or on a sidewalk, but they were upset about that and wanted you
Yeah, right.
would you please tell your emergency operations center to enforce it. And we have to zoom out and remember there's 2 million people in the county and people coming in and out of the county from other counties, and it's just we do rely on the cooperation of the public a great deal.
And the enforcement piece, just so that people understand the role of the EOC, the Emergency Operations Center, and the county itself, we don't actually have the power to enforce. Really, our job and our role is to provide the rules, and hopefully people will follow them. And we work with the local jurisdictions and with the county law enforcement, who ultimately it's their responsibility to enforce, and that means the district attorney, that means police departments in the different cities within the county. Our hope is that it doesn't get to that point. But for instance, with respect to businesses, we know that they have to follow these rules. We're trying to help them do it, trying to make it as easy as possible by giving the information. We have a call center that's available 24/7, but as complaints come in and there is a process that people can follow, we're going to work with our district attorney, and we're going to use our Office of Labor Standards Enforcement, which you actually were instrumental in creating, so that where there is clear lack of compliance and unwillingness to comply, then we will take action if need be.
Great. Tara?
So the question texted in. My question is, what is being done for residents who are disproportionately impacted by the pandemic?
Huge question. Mr. Campos and I have both been very immersed in this issue. There are 4 zip codes now that we know from the data that, geographically speaking, are disproportionately impacted. And then within those zip codes and even beyond those zip codes, we have certain demographics that are impacted, and some of it is along racial and ethnic lines, which is extremely troubling because, of course, we have had a history of that in this country, and it's been highlighted very much over the past few weeks in terms of the whole civil rights debate that's going on in this country. But I think people want to know, what are we doing about
Sure.
it, David? Maybe I can't think of a better person to answer that question than you right now, because you're right at the helm of trying to get those resources out there.
And remember, we created the Division of Equity and Social Justice about a year ago for the purpose of addressing equity issues throughout the county, and
you run that,
which I run, right? And so from the very beginning of the pandemic, we were asking the question of our communities, certain communities, being disproportionately impacted. And before we even knew the answer, what we decided is that we assumed that they would be. And so we made an added investment in communicating to those communities and educating them about COVID. So what we decided to do was, again, that we would run 5 separate websites, not only in English but also in Spanish, in Vietnamese, in Chinese, and Tagalog, that we would have separate Facebook pages in those languages, and that we would then actually make media buys in these markets. So we actually went to Spanish TV, Spanish radio, and we knew that if you take the Latinx community as an example, that this was a community that actually could not shelter in place because so many of them were actually essential workers that had to go in. So when we tried to give them relevant information, it wasn't just about stay home, but what can you do if you're going into work, if you're taking public transit. So we made that investment. We then proceeded to buy billboards throughout the county. I think we have dozens of billboards now in different languages to provide that information. We then made social media buys in Facebook and other places, targeting information about COVID and COVID safety in Spanish and Vietnamese and other languages. We actually started a campaign just recently where we're targeting over 100,000 cell phones in East San Jose and South County that are going to get information about what we're doing. Now, beyond that, we then targeted the work itself, not just the information, but some of the work in those communities. Let's take testing as an example. We really launched a very widespread testing campaign that targeted East San Jose. We created mobile units that actually have gone into those communities to test in those communities. We set out at the beginning of this pandemic a number. At some point we talked about maybe 4,000 a day in terms of number of tests. We knew that it wasn't enough for us to do 4,000, because if you do 4,000 tests in a wealthy community, it's not going to have the same impact if you do 4,000 tests in the communities that are being hard hit. And so that's what we have done. We had a day in the last few days that we were actually testing 9,000 people in one day. And we're doing it in these communities. And we're going to continue to do that in these communities. And contact tracing, we're actually making sure that the people that are doing contact tracing come from those communities as well, because otherwise we're not going to be as successful. But we're going to need to do more. And the last thing that I would say, and this is something where I give you and the rest of the board credit, on top of all of that, you just put money, close to $2 million for us to contract with community-based organizations so that we could have folks in those communities do the outreach with us directly to those residents. So that's what we're doing. We're very proud of that. By the way, this is not just a Santa Clara issue. This is a national issue, and I don't think that there is a single government anywhere in this country that is doing as much as we are to reach those communities.
Yeah, and if I can say something a little bit both philosophical and maybe sort of in defense of my own constituents, many of whom are in East San Jose, based on the district I'm elected from. We get constituent inquiries sometimes, and I know they're well-intentioned, but they say, well, what's wrong? What's wrong with them? Aren't they reading the information? Aren't they paying attention? What's wrong with you? Aren't you getting them more information? And you just addressed that. There's nothing wrong with them or with people who are working more hours of the day and who are therefore exposed to the virus for more hours of the day. And the science has proven the longer that you extend the amount of time that you're exposed to the virus, the more likely you're going to get it. So it's not about anybody not paying attention. It's about folks who are packing your groceries. It's about folks who may be doctors and nurses right here at Regional Medical Center that are waiting on people that are frontline workers. At some level, I think it's amazing that the numbers are as low as they are, that people aren't infected more, but they are really heroes and heroines. They're exposing themselves for great hours of the day so that the rest of us can get, our needs met. And I think, fundamentally, as someone who grew up on the East Side, there's an old, a famous quote that goes something like this: if you're here, to rescue me, to save me, go away. But if you're here because your fate is wrapped up in mine, then let's work together. And I think people in the East Side want to be recognized and respected as, if we get sick, it's bad for everybody. Everybody's fate is wrapped up in ours. And it's going to be hard to get your groceries or your medicine or your pharmaceuticals or whatever if everybody is sick and can't dispense those things because our frontline workers are all unhealthy. Our workforce is disproportionately people of color in this valley, and especially in terms of the non-tech sector. We know that.
Mm-hmm. Great point. Thank you for saying that.
So Steve texted in a question, and he asked, he brought up that his neighbors hold parties without social distancing, without masks, and he's asking, how can we stop instances like this?
Yeah, as David alluded to earlier, we haven't been promoting vigilantism, we've been promoting volunteerism. But people, please buy in, please get on board. However, and I've even had to do this, I'll admit it, rarely, just a couple of times since shelter in place. But if you see that happening, there's a DA line, a hotline, and there's also another county line that goes into the county logistics department that you can file a complaint either anonymously or with your name attached, that's up to you. And it's their responsibility at that point, on the other end of that line, to dispatch law enforcement to either break that up or cite people, or as Mr. Campos said, to do whatever law enforcement deems appropriate at that point. They have constitutional powers to decide, whether to cite people, arrest people, or give people a warning. But you're not expected to just drive by that party every other day and put up with it, knowing that, as we were just talking about, that behavior is going to impact everybody in the community. So sometimes you just have to make that call. Tara or Janice may have that number handy, and maybe we could read it into the microphone at some point here. But if all else fails, use the website on the screen or call my office, 408-299-5030. We have no qualms in the office about helping you to file a complaint like that. Like I said, we're not encouraging a bunch of calls to come in, but if it's one of these over-the-top things, I think you probably need to call us and let us get that information into somebody that can deal with it.
So, a question on Facebook. Why is there a variation between the Bay Area counties in terms of regulations?
Well, I know it would take me probably 15 minutes to answer this question, so I'm not going to attempt to answer it. And I'm going to let David try to do it in maybe 3 or 4 minutes.
Sure. I mean, I think what I would say, and I think Dr. Cody has mentioned this, right, that the way in which the state of California has approached this is that it has set out some parameters, but the way that has been implemented is that it has allowed certain jurisdictions to move ahead than others. And I think that's created confusion, and I think that one of the things that would be helpful to see is that if there is a threshold of what is at a minimum allowed or not allowed throughout the state, because I think that would create more consistency. In the Bay Area, we've had 6 counties, 7 counties that have moved forward together. That stopped at some point, and in some respects, the way the state approached it, led to that. But it is confusing for people. And for instance, I know that San Francisco and Santa Clara have had very similar rules, but then you have San Mateo in the middle, which actually had more permissive rules. And so that definitely confused people, and also probably had an effect in terms of how counties were impacted by the virus. So that's just the nature of how this was laid out, and hopefully we will learn as we move forward, so that the next time something like this happens, God forbid, that at least there's more uniformity.
And there's probably more uniformity in real life if you really read the regulations from every county. It seems to me the majority of the rules are the same, but the ones that are different are the ones that are going to get the most attention, the most media attention. You're going to read about the ones that are different, sure. And they just get a lot more attention when there's a difference than when they're the same, I think. So no, I just want people to know that my understanding is those emergency operations centers in those counties are communicating with each other pretty constantly.
We are, and in fact, I know that there are ongoing conversations with among the public health officers to see if they can, follow each other's approach or learn from each other's approach. I know that the risk reduction strategy that we're putting into effect, that there is a lot of interest on the part of other counties in the Bay Area in perhaps following and mirroring that. So, more to come on that.
More to come.
So the number for the DA's office is 408-792-2300. Again, that's 408-792-2300. And our next question texted in is, how difficult is it to implement contact tracing at this time, especially when people don't always pick up their phones?
It was a lot harder a few weeks ago when there weren't enough contact tracers, but there's a lot more now. And almost everything, as somebody who has to run political campaigns, almost anything involving getting people to pick up a phone anymore is much more difficult than it was just a few years ago, because we all have screening and caller ID and everything else, and And then there's privacy issues, right? Maybe you could talk about that a little bit too.
Sure. And one thing that I have to say about the Department of Public Health is that they deserve a lot of credit for the fact that they have in place hundreds of contact tracers. I think the number is north of 400, maybe 500. And the state metric based on population would have a place like Santa Clara have about 300. Yeah. So we actually have more than the state would necessarily require. So that's not something. You and I have been in local government long enough to know that hiring that many people or getting that people on board is not easy. So kudos to them. I think that we have to educate the public about the importance of being cooperative. We know right now that with the cases that we have been able to call every individual that has been reported to us as being infected within 48 or even 24 hours. So we have done that. We haven't been able to reach every person. I think the percentage is closer to about 65%. So what we would say to members of the public is that when you get a call from one of our contact tracers, we would urge you to respond to them. They are professional people who understand the importance of privacy. So they're not there to get people in trouble. They're not get to divulge personal information. Their only objective is to see who, as an infected person, you had contact with, so that those individuals can be given information not about you, but about just the fact that they may have been in contact with someone who tested positive. They're not going to be told who that person is. And again, the idea is we want you to know that so that you yourself can get tested. And if you test positive, that you can quarantine. And that between now and the time that you get your test results, that at least you isolate so that you don't have any unnecessary contacts with people that you yourself might infect. But again, so we need the cooperation of the public. More than half of our contact tracers are bilingual. They speak another language. So there is cultural competency. But again, people need to know that we're not telemarketers, that when someone calls you, it's not because they're trying to bug you, but that because it's something that it's going to help you stay safe, your family stay safe, your community stay safe.
And the county keeps no public registries. We don't do it on documentation or status.
No.
We don't do it on religion. We don't do it on race. On a voluntary basis, if someone wants to say that to us on an application, fine. But we do not keep registries, and we're not going to keep registries on contact tracing either. It's an internal, insular, confidential process, and I just want people to feel safe contacting the county, including any of these numbers or websites that you see on the screen, with complete confidence. Like we said earlier, even if you have to file a complaint against somebody that you think's breaking the rules, we're not there to keep your information. We're there to protect you and your privacy in this particular case, probably more than in any other area in government.
Absolutely. Absolutely.
So we have a question from Betty on Facebook, and she is asking about the free testing sites in the county and if it's normal for a testing site to run out of tests in a day.
I don't think that's normal. We were having a problem a couple of weeks ago where we were using the Saturday show here to exhort people and urge people to go get free tested, because some of the sites weren't fully occupied. They weren't getting all their testing done each day. What's happening most recently on that, David?
Well, I think that the number of people or the number of tests that we're performing keeps going up. And we have a website, sccfreetest.org, sccfreetest.org, where you can go online and look at the locations of all the sites. We have more than 50 sites where people can get tested. Many of those sites require appointments. Others don't, and in fact, we have mobile units that rotate throughout the county. But the idea is that any of these sites gives you a test that is free. You don't have to have a doctor's note to get tested. You don't have to have actually any symptoms to get tested. You don't even you don't have to have insurance. Doesn't matter what your legal or immigration status is. We want to make it as easy as possible for people to get tested. And in fact, anecdotally, we're hearing that there are folks coming from other counties to get tested, which is fine. You know, we don't ask a question about where people live. If someone shows up, we want that person to get tested, because testing is key to the containment of this virus. And right now, like I said, you know, we are testing thousands of people a day. The numbers actually go down during the weekend. So, you know, we encourage people, if you haven't been tested, please go ahead and get tested. If you're on the front lines, if you're in a job that actually exposes you to people, we ask that you get tested, you know, once a month. I think that makes sure that you remain COVID free. But again, you know, the county has tried to make it as easy as possible, because, you know, no one should have an obstacle to getting a test in Santa Clara County.
And you and I have the same initials and the same first name, and there's never going to be a list that said this many David C's got tested this day, right?
Right, never.
Or this many people
absolutely.
with these social security numbers got tested. That just doesn't happen.
That's private information.
Great, thank you.
Yeah, so another question about testing. Is there a place providing antibody tests? And is it true that the nasal swab testing only provides information about current infection and not if you were previously exposed in the past?
Yeah, my understanding, and correct me if I'm wrong, David, is that antibody testing has not yet been approved by the Federal Drug Administration, and that's one of the things I am most eager to see done. It just seems to me that if you could test people's immunity, which is what antibody testing does, we could figure out which kids can go to school because they're immune, which teachers can go to school and teach, which elected officials can go out and bother you by shaking hands and, you know, doing all those things. We can't do that right now because the FDA has not approved yet any antibody testing. And then the test itself, swab, how much does it really tell us?
Well, so the antibody test, as you noted, Supervisor Cortese, has not been approved by the FDA. The county really isn't conducting antibody tests right now. And even though there are a number of tests that are available in the market and many people charge for it, no one really knows the true reliability of those tests. Even if you tested positive, it's not even clear that the science can tell you that you're immune from COVID-19. So unfortunately, we don't have that yet. The science is not where it needs to be. With respect to the COVID test, you know, what it does, if you do one of the diagnostic tests that we do, it will tell you, you know, whether or not you have COVID. You know, there was a fear, especially early in the process, about how intrusive and painful the test was, which was at the beginning. You know, it had a very long swab that felt like went all the way up to your brain. That's no longer what we do, what we use. It's not very intrusive. It's kind of painless. You know, it's a swab inside your nose, you know, it's a pretty reliable test, and we try to have the results within, you know, 24 hours, 48 hours at the most. It would be great to get to a point we have testing that gives more immediate results. You know, we're not there yet. And in terms of supplies, so far we haven't run out of supplies in the county. And the other thing that we have tried to do, and unfortunately, you know, we're not where we need to be, is that, you know, the county serves, you know, many people in Santa Clara County, you know, perhaps the majority of the population, but there's also another half or so that are served by large private hospitals and private institutions. Unfortunately, those institutions are not testing at the level that they should. You know, I'm a member of Kaiser, and even though Kaiser is performing some tests, not at the level that we want them to do. The health officer actually issued an order to ask them to do more, and you know, they are doing a little bit more, but again, not at the level that you would hope. Most of this testing that has gone up in Santa Clara, it has gone up because of the county, because of the Valley Medical Center really stepping up to the plate and making it happen.
Well, even though it gives you one-time results, and I think that was part of the question, it's not going to guarantee whether you had it in the past before, just like we said about antibody testing. But this whole thing since middle of March, to me, with shelter in place, has seemed to be Dr. Cody, really leading the nation and saying, at this point, the only thing you can really do is to keep healthy people away from people who are infected. And we can kind of primitively do that by sheltering or quarantining the mass population, but then we'll ramp up testing so we have a better idea who is sick and who isn't. And if you think the test results are going to show that we don't really have a problem here in Santa Clara County, then I would exhort you, go out and get tested, and let's prove that.
Yeah.
Let's prove that an extremely small percentage of people are to worry about. If you think that there's a big problem, or there could be, the only way we're going to figure that out is to keep testing. So
exactly,
all of it is important, and we all need to try to participate.
So we have time for one last question. And a lot of folks have asked about masks and seeing folks without their mask on. And one person asks, how can we ensure that wearing masks becomes an essential part of our everyday toolkit?
I said this the other day at a news conference, Mr. Campos, and I know you were there, and I don't think anyone's expecting me to say it, but I think there's a little bit of positive peer pressure that's involved here. We don't want anyone to get in a fight with anybody else or argue with anyone else, but suggesting in your groups, in your Zoom meetings with your neighbors and so forth, that it's important and not just being quiet about it, that can go a long way. Enforcing it is tough with 2 million people out there, but there's also a little confusion about what the rules actually are. I mean, obviously, once you sit down at a restaurant with your family outdoors, you can take it off because you have to eat. Jogging, cycling, there's certain exceptions to the rule that are just practical exceptions. Isn't that right?
Yeah, and I think that people should know that in fact the state of California, this is actually one area where the state rightly tried to give guidance and have uniformity. The state actually has an order that requires that everyone who's outside wear a face covering. Again, the exceptions are things like if you are jogging, if you're doing exercise, running, then you wouldn't be required to wear it while you're running, but once you stop, you would be. If you're eating outdoors, you would be, required to, you could take it off if you're follow at a restaurant that is permitted to do that.
If you're seated, though, if you get
if
up
you're
to
seated,
walk around.
but if you get up and go to the restroom, you have to wear the face covering. So that is really, if you see people out there outdoors or inside who are not wearing a face covering, they're in fact in violation of the state order. But really, it is about not just requiring something, but really changing the way people, operate. And I would say that this idea of risk reduction, which allows for the resumption of all of these activities and businesses, it will only succeed if people, in fact, are wearing face coverings. If we get to a point where that's not happening, I think this approach will not be successful, and we'll have to pull back and go back to shelter in place, which I think is something that no one wants. And so I would simply urge people, if you really want to have more of an ability to do some of these things, if you want society to go and function with more things being permitted, you're going to have to make face coverings an integral part of your routine, and it has to be second nature for us until and unless there is a cure for this disease. That's just the reality.
Yes, and I would just say, my suggestion as one of your elected officials is if you see individuals or people in your local neighborhood or something that need to be persuaded, do that gently and persuade. Let's just keep persuading. If you see mass gatherings where people aren't wearing masks, that happened recently at one of the big shopping malls, you probably need to call us or call the DA hotline and let somebody know so that a professional can go out there and assert the rules. The rules can be asserted, and there are people that can do that. So it isn't, we're not running on hope here. There is some enforcement capability, but we have to route it through the right channels. I want to thank Viet Bay one more time for hosting us in their studio here. They've really created a tremendous opportunity. They don't charge the county for this. They do this as something charitable. Basically, they've opened up their facility so many times for to feed people, to give people masks, to host our televised, if you will, sessions here. And I want to thank my staff as well. And I want to thank you, Mr. Campos. I always call you David. People heard me do that many times this afternoon. But thank you for your time.
Thank
You've
you.
been working, as far as I can tell, 24 hours a day, 7 days a week. I'm sure you sleep once in a while, but I don't know when that is. And there's a lot of people in the county on the executive level that are working around the clock like that. Any final words you want to say to the people out here that are streaming this right now, that are listening right now, in terms of either either admonitions or just gratitude?
Well, I mean, I think first of all, gratitude to the residents of Santa Clara County. This county has been a model for the rest of the state and the country, not because of just the way that elected officials or government officials responded, but because of our residents. Ultimately, it is the actions of our residents that brought us to where we are. And the only thing that I would say is that we are at a critical juncture in the response to the pandemic. This is the next phase of the response. It's a risk reduction phase that relies on the actions of every individual and businesses. In many respects, what we're doing is unique. It's the first jurisdiction to take on this approach. And I think that we can, through the example and through the actions of our 2 million residents, show that in fact it is possible to deal with this virus effectively and still allow most of society to continue functioning. So I think that this is a county that knows how to make things happen, and it makes sense that it would be the county of Santa Clara to show the rest of the country and the rest of the world how to respond to this virus the proper way. And we're going to do that starting tomorrow.
Great. And thank you, everyone. We should be back next Saturday at the same time at 3 o'clock. If you didn't get your question answered, please contact my office, 408-299-5030, or at supervisorcortese.org, and we'll be happy to get back to you. Thank you so much.